Hello, and welcome to another episode of Quick Hit Webinars with Dr. Sean Griffin. My name is Brad Wiggins. I'm the VP of Clinical Affairs for Imbed Medical, and we're excited to have Dr. Griffin share with us today what he's doing to help reduce SSI risk in high-risk orthopedic surgery patients with the SAM technology. Thanks for joining us today.
Yeah, thanks for having me. Good evening from Kentucky. I'm Dr. Sean Griffin, Ellison Bonhausen Orthopedics, Louisville, Kentucky. These are my disclosures.
So, Dr. Griffin, thanks again for joining us. Tell us a little bit quickly about the key attributes of the SAM technology. You can see this video here that's demonstrating just an actual real-time usage of the product on a wound bed, but tell us a little bit more.
Yeah, so Surgaflex, same technology, synthetic antimicrobial technology. It is a fully synthetic, non-biologic product, but it has biologic properties and that it's bioresorbable. It is microconforming. It conforms to the wound bed. It conforms to the crevices in the wound. It is antimicrobial. It contains ionic and metallic silver at a non-toxic level, but a high enough level to provide 99.99% effective reduction in microbial burden in that wound bed within that surgical wound bed. You can use it for wound care. You can use it in orthopedic surgical procedures, foot and ankle surgery, diabetic infection-related surgery. There's also a new version of this that has lidocaine embedded that you also get the benefit of pain relief.
Thanks for sharing that, and we'll highlight that probably on another quick hit webinar is just the impact that the pain guard is having. Today, I'd like you to highlight some of your cases of Surgaflex. I've got one up here that you can share with the audience. Tell us a little bit more about this.
Yeah, so I specialize mostly in general orthopedics, primary and revision total joint arthroplasties. Here in Kentucky and everywhere, we have a high-risk patient population a lot of the times. This is one of my cases, diving right into it. This is probably my top Surgaflex use case. This is a 67-year-old female, former nurse, morbidly obese, with severe obesity in her lower extremities. Her BMI is 47 or so. She carries it all on her legs. This picture doesn't quite do it justice. There was approximately 2 inches or so between the skin and the joint. So we're dealing with a significant adipose tissue envelope, certainly high risk for wound healing complications, infection. We took her as far as we could with conservative management before she elected to do her total knee arthroplasty. We did her surgery. Everything went very well. We closed the arthrotomy. We overlaid the Surgaflex over the arthrotomy and then got a really good closure of the deep subcutaneous layer over it. So you get the effect on the wound bed below it and the arthrotomy and the wound bed above it, which is the deep subcutaneous layer, both of which I think are critical to wound healing. We closed her skin with staples and we used a negative pressure wound therapy. I used the Provena negative pressure incision wound vac, which can help prevent wound efflux, keeps the environment dry for the first week, and can help promote healing at the skin level. But the level where the Surgaflex really does an amazing job is at that deep subcutaneous layer between that and the arthrotomy closure. That's how I'm using it. This lady came back. She came back a couple weeks post-op, was doing extremely well. This is her at 6 weeks post-op. She had been fully ambulatory since, within a week of surgery. Was off pain medicine on post-operative week number 2. Was back to driving. Her motion was full. She got a little thigh calf impingement, but her motion was close to 0 to 120 degrees. She looked like she had been 3 to 6 months post-op, and this was only at 6 weeks post-op. X-rays looked great. She was extraordinarily happy, and I was very excited about this. I lost sleep over this one. Every surgeon out there listening knows exactly what I'm talking about. I'm still high-fiving myself for this case.
Glad that went well, and I love the fact that we're able to highlight a knee case here. We also have one of your hip cases. Can you tell everyone about how this hip case went for you?
Yeah, absolutely. This unfortunate lady, she was actually visiting her friend in the ICU in the hospital. She tripped on the carpet, fell, sustained a right displaced femoral neck fracture. She certainly had some risks. Type 2 diabetic, obesity, large abdominal pannus, and she also had an autoimmune peripheral neuropathy that she intermittently took immunosuppressive medication, steroids for. She was not on those at this time, but post-operative use can also be, a risk. So we did a total hip arthroplasty for her because she's still a relatively active lady. She still works, better longevity than a hip hemiarthroplasty. With her, I think her risk was probably a little bit more elevated because she'd been in the hospital environment, potential colonization or other things. So with her, we were able to do the surgery successfully. We overlaid the Surgaflex over the fascial closure or the arthrotomy. We closed the deep subcutaneous layer over it, did our subcutaneous closure. With her, we were able to do a subcuticular suture, a topical skin adhesive with Steri-Strips, and she did extremely well. She came back 4 weeks post-op. This wound was essentially pristine. Did not see the typical maceration that you see in the proximal portion of the wound, right in that inguinal crease. Did not see any of the skin slough that is relatively common here. Did not see any of the serous drainage that you can see in these patients. It really looked like a 6 to 8 week post-operative wound for a total hip in a patient this size.
That's outstanding. I'm glad that this is working so well. I'd like to show this next slide to the audience and maybe have you focus in a little bit for the audience about how effective it is against different microbes.
Yeah, so this slide shows some of the most, common pathogens in surgical site infection. You got your MRSA, your MSSA, your VRE, and some others. You see 2 lines here. This is the CFU reduction or the logarithmic CFU reduction in bacterial colonies at 24 hours on the blue line and 72 hours on the gray line. And you can see that there is a significant reduction across the board with basically bacterial growth and propagation at 72 hours. And that 72 hours really correlates with a real critical time in wound healing because you really want to get that coaptation of your outer layer to prevent any efflux from the wound and to form a barrier for bacteria to get in.
Yeah, I was wondering if you could highlight some of the research that's been done recently there in Kentucky for the audience as well. Can you tell us a little bit about this review?
Yeah, so this actually led to my interest in Surgaflex and led to directly to my use of Surgaflex. This was a case series that was done in our hospital system, looking at 100 consecutive high-risk patients for total joint arthroplasty. This was primary and revision total knee arthroplasty. Amongst our high-risk criteria, patients are diabetic, BMI greater than 35, smokers, revision scenarios. Believe they also used, rheumatoid, immunosuppressive, renal failure patients, some other high-risk criteria. The 100 case series, at the conclusion of it in 90 days, they had 0% deep surgical site infections. 2% of patients, I think 2 patients in the study, developed a superficial infection. None of which resulted in any significant reoperations. And at the conclusion of this, no signs or symptoms of deep infection.
Super impressive. And I think having a 100 patient review really demonstrates, particularly over a 3-month period of time here, just how effective the product can be in helping to manage these types of challenging patients. Also, I think the standout, like you said, also is just the fact of the comorbidities listed on the pie scale on the left is very impressive, right? I mean, this is what the orthopedic community sees on a regular basis, and it's good to know that it's actually proven in these types of patients to be effective as well. So tell us a little bit, just as we kind of close, it was kind of a quick hit webinar for us today, but tell us just key takeaways as we walk away with this information today.
Yeah, so the key takeaway is fully synthetic, non-biologic, microconforming, so it adheres to wound beds. You can use it in open wounds. You can use it in, deep wounds, surgical wounds, certainly. Antimicrobial is the other key feature. This has 99.99% bacterial reduction at 72 hours. One of the things that we'll touch on in a future webinar is that now it comes with lidocaine that can be used to expand the indications for different surgical procedures in different parts of the body, where that can be very beneficial as well.
Well, thank you so much for joining us today. Really glad to know that these are some treatment options for us out there for patients, and I hope that you've enjoyed this quick hit webinar. Dr. Sean Griffin, thank you so much. My name is Brad Wiggins, and we look forward to talking to you on a future quick hit webinar for Imbed Biosciences. Thank you.
Thank you.